चमचा ले आओ.
For Harry and Ranjan Shakula, they've received welcome news. They'll be among the first in the country to have a COVID-19 jab, and tomorrow they'll be going into hospital for their initial dose.
When I received the telephone call, I was very excited. I got the opportunity of joining in and taking part in that. So we are very, very pleased and happy and excited as well.
When he told me, then I said, what about me? And he said, well, I can ring him, Dr. Wilson, and ask him if you can come. And when he did, and he said, of course he can come with you. So yes, I'm going with him as well.
As well as those over 80, frontline health staff and care home workers are also at the head of the vaccine queue.
Absolutely chuffed that I would be amongst the first few people to get the vaccine.
At the Royal Free Hospital in London, they've been doing intense preparations for the last few days, but warned that while tomorrow may be the start, this is a slow process.
Logistically, it's been really challenging. So we are planning to bring in about 80 over 80-year-olds, but we will also open it up as well to some of our staff and to our care worker staff as well.
Over the course of the day, the Health Secretary and NHS chiefs have been touring various facilities in anticipation of what they say will be a momentous day.
Well, tomorrow is V-Day, when we roll out the coronavirus vaccine across the whole of the UK, and it's the beginning of the end of this pandemic.
EJA 553, expiry February 21.
So that's Scotland, Wales and Northern Ireland also starting their vaccine programme tomorrow. A big part of why the rollout of this vaccine is trickier is because of the temperature. The Pfizer BioNTech vaccine must be kept at -70 degrees. Once the vaccine packs are ready to be distributed, they can be transported in dry ice, giving them 10 days to reach the vaccination centre. Then in hospitals and GP surgeries, they can be kept in a medical fridge between 2 to 8 degrees Celsius for up to 5 days. It will be crucial that these steps are followed to the letter, otherwise doses could be wasted. At this freezer plant, they're trying to work out a way that the vaccine can be stored at places like GPs for a longer time, so they don't have such a small window to administer the jab.
Well, the rollout now continues through to some of your smaller establishments. Hospitals are geared up to receive equipment of this size, but your local GP might not be. So, your local GPs, your local pharmacies, they're the sort of establishments that this delivery schedule now focuses on as the next phase of this project.
The arrival of the first vaccine may feel like the cavalry has arrived, but the days of social distancing and masks are far from over. Busy Christmas scenes like this in London's Oxford Street on the weekend, as well as many other places, have some scientists warning that complacency now would be highly dangerous. We're still in a tricky winter position, and even though this is a big moment, not much will change for a while yet.